When you're entering the nursing profession and choosing this as a career, learning proper technique for documentation and reporting is going to be essential. One of the things we say in nursing is if it's not documented, it's not done. That's why we want to start here with giving you guys some information about how to properly document and understand in the healthcare profession what this actually means. So let's get started. Some of the objectives that we want to cover during this short session are going to be to really explain the purposes of documentation. We're going to look at the differences between electronic documentation and written documentation. You may find that you do both in the nursing profession. You may work in an area where you prescribe to one more heavily versus the other, but oftentimes you're going to be using both platforms for documenting. We're going to look at some approved abbreviations to use when charting. We're going to discuss some key elements of giving a report. One of those specific types of verbal client report is SBAR, which we're going to talk about a little bit later in the lecture, and I'm going to give you some examples. And then we're going to discuss some common documentation errors that you may encounter as a nurse or nursing student. So what is documentation actually? First off, let me say that this is a legal and binding document. When you chart in the patient's healthcare records, you are liable for the things that you chart and document, and in the event that there's a lawsuit or something happens in a court of law, you want to be able to look back at your documentation and know what happened during the event, know what happened during that day, know what happened with the patient. So what is documentation exactly? It is the act of recording your client assessment, the care that you've completed with the client. This could be in a written form, this could be an electronic form, but basically you're creating a client health record with your documentation. And what you want to do is it's going to be kind of a timed chronological order of what happened with the patient, what did the health providers do, and nurses aren't the only one that's documenting in this health record. It could be physical therapists, speech therapists, dietitians, the physician, it's a interprofessional approach. The pharmacy documents in the healthcare records. You want to also make sure that when you're looking at documentation, we're documenting what we are doing and also how the client is responding to the treatments and interventions that we've performed. It's important when you're documenting to make sure that you're using facts. This is not opinions. Documentation is specifically restricted to the facts. What did you see? What did you do? What do you know? It's important to get a very detailed client health history. You want to look at the past, look at the present, look at any tests they've had, look at any examinations they've had, look at the outcomes from it. Like, for example, you may give your patient may have some pain, then you may give the patient some pain medicine, and then you're going to follow up and see, did it work? So in that process, you would have documented first what was the patient's pain and what was your assessment. Second, what did you do? And third, your follow-up and how did the patient respond. So this documentation can actually be quite a complicated process. So I want to take a few minutes and talk about the purpose of the written documentation. And when I say written, I don't necessarily mean written with a pen. This could be electronic documentation, something you type in to a computer database type thing. But the point is that it's a record, a written record of your client. So why do we need a written record or a health record on a client or a patient? Well, first off, there's a lot of folks, individuals that are taking care of this patient. It's not just the nurse or the physician. And the point of this written record is so that members of the multidisciplinary team, such as nurses, physicians, case managers, dietitians, pharmacists, respiratory therapists, can communicate together about the client status, like what treatment are they performing for the client. And this helps to promote the continuity of care. Also, the client may have more than one nurse that's providing care for them. So you need to be able to communicate what you've done, but then the other nurses need to communicate what they've done. And so that's where that communication piece comes in. Which brings me to the continuity of care. You want to make sure that there's good communication so that the care doesn't stop when you leave at the end of the day, that the client's care is continued by another care provider that takes on that responsibility and also charts what happened during their shift. Quality improvement is another aspect, another reason that we want to document on our clients. We use the results to see if it works. Like if you gave the patient some pain medicine and you followed up, did the patient have pain relief or did they not? Did it work? If it didn't work, we need to investigate it and figure out, well, maybe this isn't a good medicine for the patient, or maybe we need to look at a different strategy. So that quality improvement helps really pinpoint where there are gaps in the patient care, maybe gaps in the practice that we do, and you can address those gaps. Quality improvement also involves cost. Our documentation can help show us where we are wasting cost, where we are conserving cost. So all of these things are very important. Planning and evaluation of the client outcomes is another important aspect. In our documentation, we document our plan. What are we doing for the client? What do we want the client to achieve? What are our client's goals? Did the client actually achieve the goals? And it is a record that's monitored over time. Like I said in the very beginning, this is a legal record. This health record can be scrutinized by legal experts if there's a dispute about the client's care. You will have attorneys combing through your records with a fine-tooth comb, and you want to make sure, remember I said we want to make sure that we're only documenting facts, so there's no question about the interpretation, and we want to make sure that you're documenting the client's response to any interventions that you do. Professional standards, this is something that you're going to learn more about in your Introduction to Professionalism course. You're going to learn about the American Nursing Association's standards of care within the scope of practice, and that's a part of documentation. It is a part of our professional practice and within our scope of practice that we document. And there's a lot of different standards that we have to use for that documentation. Reimbursement is another reason why the purpose for the written documentation. Insurance, private payers, Medicare, Medicaid, a lot of reimbursement, the money that the hospitals get is tied to the documentation. So for example, if something's not documented correctly, the hospital may not receive funding for it. You'll see this a lot when you look into long-term care, which is where we're going to be going this semester for clinical. It's very regulated organization long-term care is, and there's so many rules, and if you don't cross your T's and dot your I's correctly, the facilities could lose funding based on the documentation. And then education and research is another purpose. The written record provides really a snapshot of what's going on with the client. So if there's something that's unfamiliar with the diagnosis and stuff, we know what to research. It may be related to prescriptions. It may be related to the treatment, the care. So the healthcare record, research companies like pharmacy companies or treatment physicians that are doing research into medical treatments, they may look at the patient's healthcare records to see how they're responding, how the things are affecting the patient, so they know how to further treat. So these are just a few of the main purposes for the written record, and you see there is so many reasons why a comprehensive, detailed record is so important. Now let's take a look at some common formats for nurses' notes. You may see all of these in your practice. There may be one, depending on the area that you work in, where you primarily use, but let's just go over a couple of these. So a narrative note, that is kind of where you can write like a story, like in like a paragraph form of what's going on with your client. A lot of nurses who have been used to paper charting, which was at least 15 years ago, 16 years ago, in some areas, sometimes 20 years ago, when everything was strictly on paper and we didn't have these really nice electronic documentation systems. Nurses did a lot of narrative charting and notation. So you may see that now and practice more. There are some times when and as you enter the clinical setting, you're going to get trained on specific charting systems and how to document in those systems. But there are some documentation systems where they don't want you to do any narrative notation at all because it's tied to the reimbursement. So that's where you're going to have to figure out where you're working, what's your policies and procedures for the documentation at the organizations that you plan to pursue your career in. So the narrative note really is more like of a long kind of like paragraph form. Then you've got the PI documentation. It's very specific where you focus on the problem, the interventions, and the evaluation. The SOAP note is something that you're going to use, I know, in health assessment. We're probably going to be using this type of documentation when we get into the clinical setting. You're going to be charting in EHR Tutor. But with SOAP note, you write subjective data, which is what the patient is telling you, objective data, which is what you actually see with your eyes, your assessment that you completed on the patient, what is your plan based on the assessment, what are the interventions, which is coming from your plan, and then what is your evaluation of it after you've assessed, developed your plan, implemented your plan. Now, did your plan work? And then revisions, is there anything you need to do for that plan? So you'll be using some SOAP notes this semester. And as you progress in the nursing program. A focus type of nursing note is very focused. It looks at the data, the action, and the response. You'll see more of this type of assessment in areas like the emergency departments and urgent care when the patients are coming in, and this is again tied to the reimbursement. You only treat a certain thing based on the patient's presenting symptoms, and you do a very focused assessment. The FACT system is charting by exception. Some organizations will use this type of system to where you don't chart anything that's normal and you only chart the stuff that is abnormal on the patient. And then there's so many different electronic entry types of charting systems. And again, as you move into the clinical setting and different areas where you work, different organizations are going to have different platforms, but you'll be trained on those systems before you'll be required to document within those systems. There's a lot of information in your text about these different formats, and I want to encourage you to please read over these different formats of nursing notes in your nursing text. Occurrence reporting is another piece of that documentation process. This is something that you may see or do in your practice, but an occurrence report basically is like an incident report. If something has happened that is outside of the norm and we need to have a very formal record of an occurrence that's happened. This could be an error that you made. This could be an accident that the patient had. This particular document, the occurrence report, this is an organizational document. This does not go into the patient's health record because this is like an occurrence that is happening. So anytime that you have had any kind of error, whether it's a medication, even if there was not a negative effect, like an adverse effect or an impact on the client, you still need to document it because this is how research's quality improvement process works. We need to figure out, why did this occur? What happened? How can we prevent this in the future? Occurrence reports are so important for the safety and improving the quality, like I was saying, for the healthcare organization. In the report, you should report all errors, this should be a very comprehensive type thing, but it should only be facts. You need to make sure that you're very clear. You need to address the time, the date, the location, what was the client doing at the time. You want to briefly describe the incident in the objectives terms. That means just the facts. What do you know? What did you see? Now, you may be able to quote the client or the folks that are involved if possible. Again, this may not even be related to the patient. It may be that you got a needle stick while you were trying to draw up some medicine, and the only person involved was the nurse. So you would need to fill out an incident report for that. You may it may be that there was you witnessed something happen. You witnessed the patient laying on the ground, and when you came into the room, so you would need to document that and fill out the occurrence form. Even if this event that didn't get witnessed, like you didn't witness a patient fall, but when you walked into the room, the patient was laying on the ground, so you would document what you see. If there's an incident with any kind of equipment like a syringe, like let's say you did stick your finger with a needle, we would need to document about the equipment and so forth. It is just to reiterate, this is not a part of the client's health record, but this is a part of documentation because you need to know about how to fill this out, and then this is going to really help with quality improvement to make sure that we're improving the process with things. Approved abbreviations in charting is another really important thing that you guys need to make note of. Healthcare organizations establish their own list of approved abbreviations, like things you can't use, things you can use. You want to make sure that when you accept a job at a facility that you know what the list of abbreviations are. And a lot of facilities use Joint Commission as their accrediting body, and I've included a link down here below. I want you to click on this. You can see some of the very common abbreviations, codes, and symbols that the Joint Commission recommends. I've included the statement here too that says abbreviations are not used on informed consents and in patient rights documentations, on discharge instructions, discharge summaries, and other document the patient and family receives from the hospital, because abbreviations are like a common language within healthcare, but that is not a language that the patients and their families understand. So anytime you're giving the patient some information or giving the family some information, make sure that you're not including abbreviations on those documents because they won't understand what you have written. And no abbreviations of any kind should appear in informed consent on patients' documentations. Again, that's just kind of repeating it there. You need to make sure that the biggest thing is that you're following the rules of the organization. And please click on this link so you can go and look at the Joint Commission and see what they say about this. So let's talk about reporting just for a few minutes here real quick. Reporting is basically where you are able to inform other individuals, other caregivers about the client's condition. You may be the nurse reporting off to another nurse. You may be a nurse reporting off to a provider, a physician. You may be the nurse reporting off to a physical therapy, getting some information from the pharmacy. It may be that the nursing assistant is reporting off to you to give you some information about the client. But as a nurse in your role, when your scope of practice, when you are giving a report, you're either going to be giving a report to another nurse or you're going to be giving a report to another provider. Communication is going to be really important when you're looking at reporting. You want to make sure that you give them a short story about what's going on, just the vital information related to the client's plan of care, related to the client's status, what's going on with the patient. And we're going to talk on the next slide about different types of reporting. But basically, reporting is your method of communication about your client. So there is different kinds of reporting. Some standard formats that we use in the healthcare profession is IPASS, SBAR, and PACE. Those are some that you're going to see predominantly in our nursing program here, and if you practice around here in the region, you'll be using the SBAR. That's the one we kind of like. It's based on research. There's been a lot of studies done on it, a lot of um, education into teaching about the SBAR communication. But so with the SBAR, that's the situation, S situation, B background, A assessment, your assessment, and R recommendation. And you're going to be using this when you're giving a report to a physician, report to a nursing colleague, you're giving some handoff report. You can also read about these. There's a lot more details in your textbook about these different types of reporting. The biggest thing I want you to know here, I'm going to show you an example of an SBAR on the next slide, but the thing I want you to know is when you're reporting, you need to make sure that you're following this Cuban. Make sure that you keep your report confidential because we're not sharing patients' information with anyone except for the need to know basis. Who needs to know this information? You want it to be uninterrupted because when individuals start interrupting you, you can lose your train of thought and you may not deliver the most important information that you needed to. You need to be brief. Your report is not long and drawn out because the longer it is, you can lose the message can get lost between the sender and the receiver. You want to be accurate. Make sure you're giving the correct, most current information. And then you want to, if there's specific things that you need to tell about the nurse that's coming on or the physician that's taking care of the patient, name those individuals. So let's look at an example on this next slide. Here is an example of an SBAR. So let's begin with the situation. Miss Betty Smith is in room 214, ambulating with physical therapy. The patient reported an increased level of pain to her right leg. You see how it was short, sweet, to the point, but it included a lot of information. You know who the patient was, where the patient was, what the patient was doing, and what the patient reported. Pain and where was the pain. So then you want to give some background. This patient was admitted after a motor vehicle crash in which she sustained a fracture to her right femur. History of hypertension. The patient's 8 o'clock blood pressure was 117/80. And at 12 o'clock, the blood pressure was 119/77. The patient's morning dose of antihypertensive medicine was given per MD orders, and there's no known drug allergies. So you see there the background information. You taught why the patient was here in the hospital, what was the patient's, any history that the patient had, what was the patient's blood pressure, and then what have you done for the patient up to this point. See, this patient's been given some medication and let them know the patient doesn't have any allergies. So then on the assessment, this is when you get into more of the details of what did you see in the patient. At 15:30, the patient states her pain is a 7 out of 10 on a numerical pain scale. Patient states the location is to her right leg. Patient's pain level at 12 o'clock was 1 out of 10 on a numerical pain scale. Patient states her pain level was acceptable at that time and required no further intervention. 15:30 vital signs, blood pressure was 125/88, pulse 82, respirations 20, temperature 98.5. The client is alert and oriented ×3. Patient is resting in bed with call bell in reach. So you see there you got some information that you can also compare with. So the nurse told you what the patient's pain level is now, and then also that at 12 o'clock the patient wasn't having any pain. The nurse gave you in the background information what the patient's vital signs were at 12 o'clock, and now you see that the vital sign, the blood pressure there is increased. It was 119, now it's 125. And the nurse also gave you information that the patient right now is alert and oriented. So the recommendation aspect. The nurse asks, can you please put in an order for pain medication so we can help alleviate Miss Smith's pain? Should we consider adding a dose of pain medicine 1 hour prior to physical therapy to help decrease a spike in Mrs. Smith's pain level? So you see there for the recommendation, you've come up with a plan and you're basically asking the provider, can we do this? Can you give this patient something for pain? And because we know that she wasn't hurting before, but when after ambulating with physical therapy, she had some pain. So if we can give her some pain medicine before she even ambulates with physical therapy, we can help decrease this patient's pain. So this is what an SBAR, a very good detailed SBAR, looks like. Here's just some thoughts I want you to keep in mind when you're documenting your client's care. Make sure that you understand the charting system and the forms that you need to fill out. Like, is there a specific form for a falls assessment? Is there a specific form for occurrence reporting? Make sure that, is there a specific form that you fill out when a patient's transferred to a test? Or if you're sending them down for some lab work? Make sure that you chart in the required formats. Make sure that you include all aspects of care in your charting. Remember, if it's not documented, it's not done. If it's not charted, then you didn't do it. Make sure that you're accurate, complete, and concise. You need to be very clear and concise with your charting. Now I want to take a look at some guidelines for paper health records. This is where you're actually physically writing something on a piece of paper with your pen. So when you're using paper charting, you want to maintain confidentiality. Don't leave that charting laying around on the counter. Make sure that it is secured somewhere where no one else sees that charting except for the individuals that are part of that multidisciplinary team. Make sure, again, you're using the correct format, you're using the correct forms, the correct paper. Make sure that your forms are clearly marked with your client's name and identification number. Make sure you're charting on the right client. It's easy sometimes when you've got 3 or 4 clients and you grab a chart, you may accidentally chart on the wrong client. Make sure that the note you're wanting to make is on the correct client. You need to make sure you're writing legibly and neatly and in an organized manner. You're going to always want to use black ink for your handwritten nursing notes. Remember, this is a legal document. You need to use black ink when you're writing those nursing notes. Do not leave any blank lines or spaces. When you're writing those paragraphs and narrative notes, you're writing those sentences, don't leave blank spaces where someone can come behind you and write a note on top of your note or insert something in. You're going to always want to draw a line out. If there's a space on that line, just draw a line to the end of it to make sure that no one else can come behind you and document. You're going to want to draw a line completely through anything that's incorrect and put your initials on top of it. You're never going to use like whiteout correction fluid, anything like you can ink over it. You're never going to want to try and cover up your documentation. You're never going to write over your documentation. If you document something is incorrect, one line through it and then put your initials. You need to sign all of your paper documentation and entries with your first name, your last name, and your professional credentials. So like you would, for example, for myself, my name is Kelly Moran, and then I would put MSN, BSN, RN, because those are my credentials. You guys will put your names and then nursing student, UNCP. You're going to want to make sure that you're using the approved abbreviations for your organization. And there are a lot of different abbreviations. That's why we didn't go over specific lists of abbreviations. But please click on that link with the Joint Commission so you can see what those abbreviations are. When you're charting in the electronic health record, so you're doing like computer charting, some guidelines that you need to make sure that you're following for those records are to make sure that understand how to use the computer equipment. Make sure that you understand the charting format and the documentation for that. Make sure that, this is a big one, that you save your information that you've entered. Sometimes you may be in the middle of charting and then something will happen with your patient and you'll need to immediately respond to that. So you want to frequently save the data that you're entering so that your documentation doesn't get lost. You're also going to want to make sure that you're documenting on the correct patient. There are protocols in place where for different charting systems where you may scan your patient, but you may click on the patient. I have seen it in times where nurses and students have documented on patients and it's not been the correct patient. So then they've had to delete all of that documentation that they completed on that individual and then type it in on the correct individual. And that's a time waster when you're documenting. You want to make sure that you're following the process, the organizational procedures if the computer goes down, because there's always technical issues and glitches and updates to the system that need to happen. And sometimes the computer may be down for 30 minutes. Sometimes it may be for 4 hours. Sometimes it may be 12 hours or 24 hours. So you need to understand the process of paper documentation and knowing what to do in the event that the computers go down. Again, when you're on the computer and documenting, you want to make sure that you're maintaining that confidentiality, that HIPAA, the patient's privacy, and not sharing those records with anyone. You also want to make sure that you're only looking at the healthcare records of individuals that you're providing the care for. You can lose your job by violating that patient privacy and confidentiality and looking at other people's healthcare records, and you don't have a responsibility to provide care for that patient. And then you want to make sure that your data is secured. You're never going to want to walk away from a computer device and leave your patient's screen up. You're always going to want to make sure that everything is secure before you leave your workstation from charting. So some common errors that we see related to documentation is not dating your entry, not putting a time on it, not signing your documentation entry, or writing sloppy or illegibly where it can't be understood what you actually meant, not documenting omitting medications or treatment, leaving information blank on the forms, adding late entries where you've forgotten to document something, but then you go back in and documenting subjective data. Remember, you're supposed to be documenting what you actually see. And if there is subjective data that you have to document, you would always quote like the patient states this, or the physician states this, or the nurse Kelly stated this. Make sure that, again, that you're using appropriate abbreviations. This is a big one here. Using trailing zeros. You never want to use a trailing zero. Like with this example, 10.0 milligrams. That should be documented just as 10 milligrams, because that little tiny dot can sometimes get missed and it may be interpreted as 100 milligrams. And there's a big difference between 100 milligrams and 10 milligrams. So when you're documenting, make sure that you are not using the trailing zeros. The other documentation error that we see is accepting incomprehensible orders. You need to ask questions, seek clarification. If you don't understand what the physician has ordered, make sure that you are seeking clarification. Failing to document new symptoms or conditions, not documenting is just as bad as documenting the wrong things. And then entering information into the wrong charts. And yes, unfortunately, this has happened. I can't tell you how many times I've seen nurses document on the wrong patient. So make sure that when you're documenting that you have selected the correct patient. So documentation really is a lot, but really it's one of the most important things that you're going to be doing as a nurse. You could provide the best care in the world, but again, if it's not charted or documented, there's no proof that you've done anything. That's why knowing how to correctly document, knowing where to document, knowing when to document, the right formats, the right forms is really important. As you progress in the clinical setting, you're going to get more information about documenting and the different platforms for documenting. We're not going to expect you to go into clinical and be able to chart off the cuff without even understanding the systems and how it works. This is something that's going to really evolve over time, over the next course of the next 2 years. But as you read through the information in your chapters and stuff, if you come to questions or have something that you just want to seek some more clarification on, please feel free to send me an email. I am here to help and answer any questions that you may have. And again, you're just getting started, so it's easy to feel overwhelmed right now. But as always, if you need anything, please don't hesitate to contact me. Happy studying!